Hello everyone. In this class, we'll learn about glomerular filtration. Glomerular filtration is the initial step in urine formation. The plasma that traverses the glomerular capillaries is filtered by a highly permeable glomerular membrane, and the resultant fluid, the glomerular filtrate, is passed to the Bowman's capsule. Glomerular filtrate is identical with the plasma in respect of osmolality, pH, electrical conductivity, concentration of electrolytes, except that it contains no proteins and no cells. Therefore, glomerular filtrate is called as ultrafiltrate of plasma. Hence, glomerular filtration refers to the volume of glomerular filtrate formed each minute by all the nephrons in both the kidneys. The normal value of GFR is around 125 ml per minute or 180 liters per day. Factors affecting GFR, that is, the GFR mainly depends on the coefficient of filtration, and then it depends on the hydrostatic pressure in the glomerulus, hydrostatic pressure in the Bowman's capsule, then oncotic pressure in the glomerulus and oncotic pressure in the Bowman's capsule. So GFR depends on all these factors, where Kf is filtration coefficient, and Pg is hydrostatic pressure, which is around 60 mm with G. Pb is hydrostatic pressure in Bowman's capsule, which is around 18 millimeters of mercury. Pi G is colloidal osmotic pressure in the glomerular capillary, which is around 32 mm of mercury, and pi B is colloidal osmotic pressure in Bowman's capsule, which is negligible because you do not plasma proteins are not filtered. And Kf is a coefficient, filtration coefficient, which is nothing but the multiplication of permeability of capillaries and the effective capillary surface area. Hydrostatic pressure in the glomerular capillary. GFR is directly proportional to the hydrostatic pressure in the glomerulus. Increased arterial pressure causes increase in Pg, so GFR increases. Increase in the afferent arterial resistance decreases the Pg, that is hydrostatic pressure, then GFR decreases. And increase in efferent arterial resistance increases the hydrostatic pressure in glomerulus, but renal blood flow decreases, therefore GFR increases slightly, but if there is a severe constriction, GFR decreases. Hydrostatic pressure in the Bowman's capsule. The hydrostatic pressure in the Bowman's capsule increases in case of obstruction of urinary tract. Then the GFR decreases. For example, kidney stones, and GFR is inversely proportional to the hydrostatic pressure. Colloidal osmotic pressure in glomerular capillary. GFR is inversely proportional to the oncotic pressure in the glomeruli. In hypoproteinemia, that is, pi G decreases, so GFR increases. During dehydration, pi G increases, then GFR decreases. Increase in arterial plasma oncotic pressure uh, increases uh, the oncotic pressure, so it decreases the GFR. Increase in the filtration fraction, that is nothing but the fraction of plasma filtered by glomerular capillary, causes increase in pi G and so decreases the GFR. So filtration fraction can be given by GFR divided by renal blood flow, which is around 19%. That is the 19% of the renal plasma flow. In colloidal osmotic pressure in the Bowman's capsule favors filtration. Filtration coefficient is a function of membrane permeability and capillary surface area. And permeability of the capillaries depends on the size of the particle and the charge of the particle. All neutral substances having a diameter less than 4 nanometer can pass through. Around 4 to 8 nanometer particles can pass based on the charge and size. Particles greater than 8 nanometer are completely withheld. Glomerular membrane contain proteoglycans which are negatively charged, so they repel negatively charged albumin. Capillary surface area, that is contraction of mesangial cells, decrease surface area available for filtration. This decreases the filtration coefficient. Angiotensin II is an important regulator of mesangial contraction. Note that in chronic uncontrolled diabetes mellitus hypertension, the filtration fraction decreases due to the thickness of the glomerular capillary membrane. Then it also depends on the renal blood flow. GFR is directly proportional to the renal blood flow. And the age, where the GFR decreases with increasing age due to the decrease in the renal plasma flow, cardiac output, and renal tissue mass. Regulation of glomerular filtration rate. It is mainly done by autoregulation, neural mechanism, and hormonal mechanism. Autoregulation, the glomerular filtration rate is regulated accordingly with the renal blood flow. How the renal blood flow is regulated in a similar manner, glomerular filtration rate is regulated. Similarly, neural also it is regulated by sympathetic and parasympathetic, but the neural regulation do not have much role to regulate glomerular filtration rate like renal blood flow. Then there are hormonal influence like the hormone or autocoid norepinephrine decreases the GFR, epinephrine decreases the GFR, endothelium is going to decrease the endothelin is going to decrease the GFR. Angiotensin II may not change but prevents the decrease of GFR. Then endothelial derived nitric oxide increases as well as prostaglandins. Note that net filtration pressure is the balance between the pressure favoring filtration and pressure opposing filtration. So net filtration can be given as Pg minus Pb minus pi g minus pi b, and hence GFR can be given as the constant the filtration coefficient into net filtration, where the Kf is filtration coefficient for the glomerular membrane and is around 12.5 ml per minute per mm of mercury. It is the GFR at 1 mm of mercury NFP. Filtration fraction is the fraction of renal plasma which becomes the filtrate. So filtration fraction can be given as GFR divided by plasma flow into 100. Normally it is 0.16 to 0.2. Thank you.